Hello everybody, welcome to my channel. How are you doing? From whichever part of the world you're watching this video from, I hope you are doing okay. My name is Lubem. If you are new to the channel, subscribe. Also, don't forget, turn on the notification bell just in case I release another video like this, you can follow. So in this video, I'll be talking about depression, 7 causes of depression. Now, there are so many other causes of depression you might see out there, but these are just the ones I will give just for the course of the video. Stay calm, don't change the channel, and also wait till we talk about the video. All right, now, depression can be caused by so many reasons. There are so many triggers that can result to depression. Some people might just feel depressed just by waking up and having a particular pain in their body. You have people like that. So many reasons or so many causes of depression. But what are those, common causes of depression, clinical causes of depression? Number one on the list is stressful event. Some people can really undergo a lot of stress without being depressed. Now, you have a lot of people who are used to stress. Some people can have an enormous form of work daily and still not be depressed. Meanwhile, you have some people, if they just undergo a little form of stress, they are depressed. So now you have, different variations. But in overall, stressful event can also result in variations. Some people might go through maybe it's your work stress, could possibly your family stress, whatever the reason could be. That stressful event can also result to depression in different ways. The second one on the list is personality. Now we live in an internet world, right? So every day you wake up, there's something you're going to see probably on the internet that will probably make you insecure. And then we'll have many people who, just feel insecure about their physical appearance. Sometimes, when they look at someone on the internet with a fine picture or probably something like that, and then they try to compare with themselves. So just by mere looking at these things, they feel depressed. They feel as if they are not good enough. They feel as if they are not really, something like that. And then it just make them depressed. Partially. Sometimes it could be complete depression, sometimes it's partial depression. The third one is family history. So sometimes your parents or maybe your loved one, someone, a relative, someone in the bloodline must have developed that form of that trait of depression. You might possibly are most likely try to experience that one too in different areas. Some people don't. Like let's say if your mother was the type of person that feel depressed always, the children might not be depressed. Some children might, but some might not. But that a family history also has to play a very big role in terms of depression, right? And then the third one we have the fourth one, I have loneliness. Now, loneliness and personality work hand in hand. Some people feel lonely, maybe if they don't have enough friends, maybe if they don't have places to go to, maybe they are bored, maybe they feel completely cut off from family or maybe friends. This could make them feel lonely. And one thing about loneliness is whenever you feel lonely, you feel depressed. Because when you feel lonely, you start looking at yourself like, what is wrong with me? Is there something wrong? Why is it that nobody wants to talk to me? These things can cause depression. There's another form of depression, though, in women after giving birth. They call that one postnatal depression. Now, this depression comes after the woman has given birth. Although it does not last for that long, sometimes it's like 2 weeks, sometimes probably more, or maybe, but it doesn't just last that long. Now, this depression comes because to some women, this is the first time they are having, giving birth, right? Some women, this is the first time they are putting to bed. And some women who are used to it, they might not experience it. It mostly comes in women which have their first pregnancy. So they start getting afraid or scared that maybe they might hurt the child. Or maybe you notice some don't even have the time to look after themselves, talk more of the baby. This could cause them to be depressed. Now, this depression, if you don't understand it, sometimes you might mistake it for some other reasons. But you know that's postnatal depression. That's another topic, somewhere else. And then the sixth one will have illness. Now, illness has to play a very big role in depression. Let's say someone goes to the hospital, right? They were fine. They were doing normal life, going about, nothing happened. And then they were told that they've been diagnosed with cancer. Or let's say a heart disease. Instinctively, this causes some form of anxiety. They just start feeling like, okay, I heard of someone that had cancer and the person died. This could result to depression. Because they start feeling as if the same thing that occurred to that person they must have heard a story about could do the same thing to them. Not knowing that there are countless of people who have also survived from that same illness. Or maybe some people had worse than that, but they also survived. This incorporated with the other ones I mentioned, you notice that they can greatly affect someone's mental state. And the last one is alcohol and drugs. Many people believe that for them not to be depressed, they need to take a lot of alcohol. abuse the alcohol probably, also take a lot of drugs. Well, let's say the drugs such as cannabis, right, can help you relax. But research has also shown that these drugs can also cause some form of depression. Alcohol, on the other hand, yes, it makes you probably feel relaxed and numb to some extent, but it can also affect your brain, right? It has some form of, danger or injurious to your health system itself. Now, these things can also result to illness, and the illness can also cause depression. So it's like a chain reaction. So one can trigger the other one to happen, and the other one can cause the trigger one to happen. So now when the person gets this illness and maybe they don't have enough friends to come see them, they also get depressed. Loneliness, remember, comes in. Personality comes in. All of these things clinically could just jam pack in this person's body. And then the next thing is maybe the sickness itself is not even affecting them. Maybe it's even their mental state that is even affecting them the most. These are the 7 causes or clinical causes of depression. Now, what do you need to know? Or what does the person need to do in terms of depression? Depression, I would say, it's like based on yourself or your mental state itself. So let's say something you don't believe in will not have an effect on you. If you notice, there are some superstition. If you go back to tradition, you on a nutshell, you probably don't even believe in those superstitions, so they don't have an effect on you. Someone who does believe in those superstitions, you will see that it might have an effect on them because they believe in it. So if you believe that you are depressed, yeah, you'll be depressed. But if you don't believe it, oh well, I can get out of this. You have an illness, I believe I can be fine. You have this, I believe I can. Okay, I've been stressed out from work all day. Well, maybe next week to be better. You see, if you can train your mental state or your emotional capability to be strong enough to withstand some of these things, it will be hard for you to depress. But now, are we saying people who are depressed they are not strong enough? Because I know strong people, a lot of strong people who can still be depressed. Now, there are so many situations, so many circumstances, so many events that can cause some people to be depressed. And you might not blame them because it is a lot to handle, right? They must have lost someone in death. Some people must have, there are so many reasons that could cause some people to be depressed that you probably wouldn't feel the same way because you've not experienced that. The person in that kind of a situation, you don't need to judge them. You don't need to be like, oh, well, your mental state is not strong. Dr. Luben said, if your mental state is not strong. No, I'm not saying so. In that kind of situation, you're supposed to help those people. You're supposed to be around them. You're supposed to support them. Because it's not, sometimes people don't intentionally want to be depressed. These things come unexpectedly. But you just have to be there for them till maybe probably they come out of it. Because there's no particular treatment in terms of drugs that you give to the person to come out of depression. Sometimes it might even worsen the case. So let's say you give someone drugs to take because they lost a loved one. And the drugs might probably help them temporarily. But is it going to help them to come out of it because they lost a loved one? No, probably. The only thing that will help them by that time is you constantly being with them, or also making them understand that they still have people around them that could help them with depression. Thank you so much for watching the video. I hope you enjoyed it. If you did, subscribe. Also, if there's anything you want